Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral fully occluding earwax, and prior to attending they were using some Cerumenolytics, which is the medical term given to earwax softening drops. They weren't sure what type of drops they were using, so typically you get three types. You would get oil-based drops, so the most common type of oil used in the ear is olive oil, but there are peanut, almond oil alternatives on the market. Then you can get water-based cerumenolytics, such as sodium bicarbonate drops and hydrogen peroxide drops. Then you can actually get water-based and non-oil-based drops, such as hydrogen peroxide with urea. So there is no water, but when the hydrogen peroxide enters the ear and it reacts with an enzyme, it does convert into water. So technically, you still put that as a water-based drops. Now, I've just put some oil in myself just to help further bind this wax. Sometimes if a patient overuses drops prior to their appointment, the wax becomes very loose and wet. And I preferably want to remove this in large pieces just like that. And olive oil during the procedure itself has this binding effect. It almost acts as an egg in a cake, fish cake or potato cake recipe. It just binds, it's like the glue, it binds it together. This last piece is quite large. It's been there for a bit longer. You can tell by the colour it's a bit oxidised. I'm just going to give it a little wriggle. There's going to be some residual soft wax around the edge because of the amount of drops the patient used, but that's fine. A bit of wax is good for us, guys. And I have to stress that earwax is not bad for you. It's only bad for you if you have too much. We all should have some wax. I know I've got wax and it's there for a reason. That's why our bodies produce it. It's oily and greasy, so it helps to moisturise the skin that lines the ear canal. It helps the internal skin retain its moisture. In the absence of this oily, greasy earwax sitting on the surface of the skin will become very dry and cracked, and that will lead to itchiness. So it's your ear's natural moisturiser. Then earwax is mildly acidic, and the acidity helps to keep native bacteria at bay, prevents them from becoming pathogenic. Earwax is also sticky, so any foreign particles that enter the ear, they stick to the wax captures it. And for most of us, the earwax naturally migrates, so it helps the ear to cleanse itself. And the acidity, going back to the acidity of earwax, it's also believed to be a natural insect repellent, so it prevents creepy crawlies from entering your ear at night when you're blissfully unaware. You can see just such a much of a wriggle having to apply here, and in part that's because this wax plug is enveloped by some dead skin. You may have noticed also at the entrance of that ear there is quite a bit of a dip. It's a subtle dip. It goes down and up again. Most of our adult ear canals anyway, there is a natural upwards trajectory around 32 degrees, but in this patient there's a preceding dip, and it goes back up, and it could be that the wax, as it's trying to migrate, it's falling into just there at the bottom. It gets trapped in that little divot, and then it can't come out of it, so you get a build up. Also, their inferior recess, so when you go to near the eardrum, the ear canal narrows and then widens again, and it creates a basin at the bottom called the inferior recess. And this view, you may be able to see that divot a bit better. Sorry to just move away from the eardrum. You can see there at the bottom, there's a good view there. It's almost like a mountain peak. It kind of goes down and then up and then down again, mountain slope. And that inferior recess is quite a pronounced one, and sometimes you can't fully visualise the eardrum as a result, and sometimes earwax can drop into that inferior recess. It can be difficult to remove. This is their right ear, similar tail, very sticky wax, so I'm going to put some oil, I assume I am, we'll just see. This is right near the entrance, guys, hence why the endoscope is right close to it, because the endoscope needs to be in the ear because it's an endoscope, the clue's in the name, in order to visualise the wax. And of course, if the wax is near the entrance, you're going to see it. Now, you can get an endoscope with extremely, extremely wide field of view, so even when the endoscope is in the entrance of the earwax looks further away. The problem with that is, although for earwax close to you, you get a good field of view, and it may not be as close up, but then the eardrum is so far away from you, because there's a trade-off between field of view, how much periphery you can view, and the magnification. You can't have great magnification and a wide field of view, because the two things they contradict each other. So, of course, we need to be able to see the eardrum and remove wax deep from the ear. So you have to get that right ratio of field of view and magnification. Otherwise, if you opt for the field of view, the eardrum is so far in the distance, you're having to put the endoscope in quite a lot into the ear, and you may not have to go far enough in because it'll be uncomfortable, it physically won't reach. So ideally with the endoscope, you don't want that to go any more than 1 centimetre into the ear. So it's getting that correct trade-off, which is what the iClotoscope has achieved. So guys, just a quick point. So in the UK, from the 31st of January, there's a new scheme called the Pharmacy First scheme. Now, this is not a dig at pharmacists, and I don't want to be misquoted. I've got a lot of respect for pharmacists. I've got friends and family members who are pharmacists, but myself and other audiology colleagues are getting contacted by some pharmacists now, because by the beginning of next month, they are involved in this NHS-funded scheme where they are able to treat patients for earache, or more specifically otitis media, which is a middle ear infection. And although I've got no doubt pharmacists have got the skill level to expand their scope of practice with the appropriate training guides and experience and assessment, currently, under this Pharmacy First rule, there is no mandatory training or assessment. The pharmacies themselves or the pharmacy owner have to almost determine whether they are competent and whether their staff is competent. And naturally, that's not always going to be accurate. It's very difficult for people to ascertain their own competency level. And of course, there's financial incentives involved. I think it's £15 per consultation. There's upfront funding and then ongoing funding after that, I believe. So I've got no qualms about the scheme in principle, but the way it's being launched, I don't think it's adequate in terms of the skill levels and the training. So, for example, there's no mandatory requirement to go on a face-to-face otoscopy course. You can watch online modules. That's just not how you can't teach someone how to perform otoscopy just by giving them videos online and showing them this is where you hold it, etc. So, and again, these are not mandatory courses. A pharmacist could think that they know everything there is to know about ears and think they don't need to go on this course. So there is, as I said, no. Now, the pharmacist owner has to provide some evidence that they are competent, but from an audiology background, I know how these things work. So it's not a very watertight way of measuring competency. So now, I don't want pharmacists to take it the wrong way. That's not the reason for that. Why I'm mentioning it. The reason why I brought it in conversation is that I've been approached by a few pharmacists, and I know colleagues who are worried about this. They don't feel they've got the appropriate skill and training. They wanted some work experience as well from myself and some colleagues, but yet they are going to be expected soon to offer this service. So it's a bit worrying. I can almost compare it to me as an audiologist. Now, I've learnt a lot about ear medications, but I wouldn't be comfortable prescribing it without going on a properly accredited training course that's got a proper assessment. It's well constructed, it's in depth, because I don't know the side effects of a lot of these medications or their contraindications or how they may react to other medicines and other health issues a patient does have. So you can't expect an audiologist to start prescribing ear medication, although we kind of know which ones are good for the ear in that respect, or some of us do, but without the appropriate training. So there's no difference. And on a final note, Asda, which is a big supermarket in the UK, their opticians or optical area is now offering earwax removal. Take care, guys. Bye.